Hello students, myself Dr. Mariam. Let's get right into today's topic. I hope you all are ready to learn about gallstones. So, what are gallstones? Gallstones is also known as cholelithiasis, which is a hardened concentrated piece of bile that form in our gallbladder or bile duct. Gall means bile, so gallstones are bile stones. So here the word cholelithiasis, in this the chole means bile and lithiasis means stones. So our gallbladder is our bile bladder. So it holds and stores bile for later use, and like our liver makes bile, and our bile ducts carry it into different organs in the biliary tract. So we use the term cholelithiasis to describe the condition of having a gallstones. So, gallstones form when bile sediment collects and crystallizes. Often, the sediment is an excess of one of the main ingredients, that is bile. So, gallstones, like it basically won't necessarily cause any problems for the patient, but a lot of patients have them, and or a lot of people have them and never know about this. But gallstones can become dangerous if they start to travel through the biliary tract and get stuck somewhere. They can clog up the biliary tract, causing pain and serious complications. The problem with the gallstone is that they grow slowly but surely as a bile continues to wash over them and leave another layer of sediment. So, what begin as a grain of sand can grow big enough to stop the flow of bile, especially if it gets into a narrow spaces like a bile duct or the neck of the bladder, etc. And it is a small pebble like substances which may occur anywhere within the biliary tree, and it ranges in the size small as a grain of sand to as a large as a ball also. It can be multiple also or solitary. So this is what the common introduction between about the gallstones. The risk factors. So variety of diseases and conditions can affect the bile flow, or like our cholesterol, bilirubin or bile acid levels, but not everyone with gallstones has an underlying condition. Some of the most common risk factors are normal factors such as the age, genetic profile, hormone levels and weight fluctuations, etc. So, age, when talking about age, the gallstones take time to develop and grow large enough to cause an obstruction. So, males are more likely to get them after age 60, and females are more likely to get them during their fertile years, roughly between the ages of 20 and 50. And so women are most commonly getting early affected with the condition. And coming about talking about the hormones, the females are 3 times more likely to get gallstones. Their risk peaks and declines with their estrogen and progesterone levels. Estrogen increases and cholesterol levels, while progesterone slows the gallbladder from emptying. And the next one is overweight or obese men and women. So body fat releases estrogen, so having more of it raises the estrogen level and the cholesterol level. On the other hand, a rapid weight loss, like after weight loss surgery, can also cause gallstones. Losing body fat quickly releases large lots of cholesterol into the bile. And other risk factors are family history, diabetes, diet high in cholesterol, use of oral contraceptive pills, and pregnancies. And so these are the few risk factors of gallstones condition. Gallstones form when there is an excess of one of the main ingredients in bile. The excess ingredient turns into a sediment at the bottom of the gallbladder or bile duct, and the sediment gradually hardens into stones. So, cholesterol stones are the most common type um, of cholelithiasis, that is the gallstones. And other stones are other types are pigment stones, that is the bilirubin stones, and a kind of a mixed stones. So now we'll discuss about the common type of stones. First one is pigment stones. So pigment stones, it is also known as the bilirubin stones. It is a small. It will be a small, friable, irregular. It will be in dark in color, made up of bilirubin and calcium salts. It is less than 20% of cholesterol, and the risk factors are hemolysis, liver cirrhosis, biliary tract infections, and ileal resection. So excess bilirubin is one of the causes of the main cause of the pigment stone. So bilirubin is a byproduct of broken down old red blood cells, that's the old RBCs, and the patient might have an excess of bilirubin if the patient have a blood disorder that destroys too many RBCs, or if the liver is impaired in some way and struggling to process its normal load of bilirubin into bile. So this is why the formation of big pigment stones are happening. The next one is cholesterol and mixed stones. So cholesterol stones, we can explain because it is because of the excess production of cholesterol. The patients, like for example, the liver of the liver extracts cholesterol from the blood to make bile. So if there is too much cholesterol in the blood, the proportions in the bile will be off. So bile needs a balance of lipids and acids to hold all the ingredients together, so any excess will fall by the wayside. So this is why there can be a formation of cholesterol stones. The stones will be large, often solitary stones, which can be in yellow, white, or a greenish green color, made primarily because of cholesterol that is in more than 70%. And the risk factors are 4F. You have to remember 4F: female, 40, fertile, and fat. That is, female are more prone of getting cholesterol stones, and 40 maybe, like as I've mentioned, the age of 40, after age of 40 the people are more prone of getting this cholesterol stones, and fertile period of the women, and fat because of the excess obesity or overweight of the patient. And when talking about the mixed stones, it can be multiple, it will be faceted, and consist of calcium salts, pigment, and cholesterol. So it is a combination of all the cholesterol stones, pigment stones, and calcium salts. So it will be 30 to 70%, and 80% is associated with the chronic cholecystitis. So this is what called the mixed stone. So these are the three types of stones which we discussed about in the gallstones condition. That is a pigment stone because of the excess bilirubin, and cholesterol stones because of the excess cholesterol, and the mixed stones, the combination of calcium salts, pigment, and cholesterol. Moving on to the uh, pathogenesis. So pathogenesis, as it is mentioned here, the bile, because of the bile salts, phospholipids, and cholesterol. Gallstones are formed due to the alteration in the ratio of these bile salts, phospholipids, and cholesterol. So pathogenesis involves in three stages. That is the cholesterol supersaturation, bile crystal nucleation, that is the mucin hypersecretion of GB mucosa creates a viscoelastic gel that fosters the crystal nucleation. And the third one is bile stasis, that is the fasting, because of the fasting or oral contraceptive pills and pregnancy or vagotomy or prolonged TPN. So these are the three stages where there can be a formation of this gallstones. Next, coming to the clinical manifestations. So gallstones generally don't cause any symptoms unless they get stuck and create a blockage. So this blockages cause symptoms, most commonly the upper abdominal pain and nausea, and these may come and go, or they may come and stay. So the patient might develop other symptoms if the blockage is severe or last for a long time. And the patient might feel pain in the right upper quadrant, and pain under the right shoulder when lifting arms, fever, nausea, vomiting, and jaundice, abdominal swelling, tenderness, dark colored urine and light colored stools, low blood pressure, and there is one important sign which is called as Murphy signs. So the patient might have a inspiratory arrest with the manual pressure below the gallbladder. So that's the sign while doing the examination of gallstones. So this Murphy sign is associated with the inflamed gallbladder, that is the cholecystitis. It is the pain that occurs when the patient deeply inhales and the practitioner or the doctor deeply palpates the right upper quadrant just below the ribs. So the patient will have a pain over there, that is the called as Murphy sign. And the how what is gallstone pain feels like. So typically gallstone pain is sudden and severe and may make the patient sick to stomach, and so this is called a gallstone attack or a gallbladder attack. So the patient might feel most severely after eating when the gallbladder contracts, creating more pressure in the biliary system. It may make the patient wake from the sleep. And gallstone pain that builds to a peak and then slowly fades is called as biliary colic, and it comes in episodes that may last minutes to hours. So the episodes ends when and if the stone moves or the pressure eases. So the patient describes the pain as an intense sharp stabbing, cramping or squeezing pain, and the patient may not be able to sit still. So that is how the patient feels this pain. And where the gallstone will be located, pain will be located. So as I mentioned, in the biliary system, in patient's biliary system is the biliary system is located in the upper right quadrant of the abdomen, so which is under the right rib cage. So most of the patient feel gallstone pain in this region, but sometimes it can radiate to other areas also. So some people feel it in the right arm or shoulder or in the back between the shoulder blades, and some people feel the gallstone pain in the middle of their abdomen or chest. So this can be confusing because the feeling might resemble other conditions. Then some people mistake this gallstone pain for heartburn or indigestion, etc. So others might feel like they are having a heart attack, so which is a different emergency. And females may be more likely to experience a referred pain, so pain that the patient feel in a different place from where it started. So they may have, so there may be more likely to experience gallstone pain in the arm. So females will experience more in the arm or shoulder or chest or back. And females are also more prone to chronic pain, and they may be more likely to dismiss pain that comes and goes like biliary colic does. So it is important. So it is very important for us to like to know about any severe or recurring pain, even if it goes away. And once we have a, like if the patient had a gallstone attack, so uh, the patient might will get the gallstone attack again also. And there are few conditions which will trigger the gallstone pain. So gallstone pain means that gallstone has gotten stuck in the biliary tract and caused a blockage. So if it is a major blockage, so the patient might feel the pain in a right way. If it's only a partial blockage, the patient might not notice until the gallbladder contracts, creating more pressure in the system. So there are few things with it, like eating triggers this contraction. A rich, heavier, fatty meal will trigger, or bigger gallbladder contraction can trigger the condition. That's because the small intestine detects the fat content in the meal and tells the gallbladder how much bile it will need to help to break it down. So the gallbladder responds by squeezing the needed bile out into the bile duct. So this is what happens, and this is what which will trigger the pain. And there are important warning signs of the gallstones, that is the biliary colic. It is the only warning sign of gallstones that the patient get, and it happens when a gallstone will causes a temporary blockage, then manages to move out of the way and let the bile flow through again. So even though the pain eventually goes away, it's important to recognize these episodes as the warning sign that they are. Next is the diagnosis. So investigation we have to do with the blood test, that is CBC, LFT, clotting profile, amylase and lipase. And so we can detect the inflammation, infection, jaundice, and offer clues to which organs are affected. And we can also advise imaging techniques like USG, CT scan. So that will help us to locate the source of the blockage in the biliary tract. And other important tests are MRCP, that is the magnetic resonance cholangiopancreatography, then HIDA scan, endoscopic ultrasound, and ERCP, that is endoscopic retrograde cholangiopancreatography. So these are the few diagnostic techniques with which we can diagnose the condition of gallstones. Next is the management. So, if the gallstones never cause problems, then there won't need any treatment for them. So, but if the gallstones cause a blockage in the biliary tract, then we have to remove them, not just the blockage, but all of them. So, once the gallstones have caused a blockage, they are highly likely to do so again. So, most of the people who need treatment for gallstones will have a surgery to remove them, and surgery is the only way to ensure gallstones won't cause further issues for the patient again. But if you like, if we can't or don't want to have a surgery, there are some alternative treatments to try, including medications and procedures. So the medical treatments for gallstones, like we can provide is urcidol, quinodol, quinodiol. So these are the medications which only work on smaller cholesterol stones, but that haven't caused any complications yet. But other in other case, with the medical treatments with medications, we can't do so. The only way we can do is through the surgery. And with the medication, it can take months to years to dissolve them, and then there are chances that the stones might return. So this is not a practical way to treat the gallstones for most of the people, but there may be a limited circumstances where medications are helpful as a temporary or preventive measures. And The most important part is the surgical management. So surgical management, as I have mentioned before, so most of the people where if the patient in case of patients where the gallstones is created a blockage in the biliary tract, then the surgery is the only way to remove the gallstones, so that it will not cause any issues or emergency in the future. So such surgery are like cholecystostomy, subtotal cholecystectomy, open cholecystectomy, and laparoscopic cholecystectomy, and mini cholecystectomy. So these are the surgical ways with which we can treat the condition of the patient. And so this is the, as I've mentioned, if in case the gallstones are blocking the biliary tract, then surgical management is the only possible way with which we can remove the gallstones, so that it will prevent the further causes in the future. Coming to the differential diagnosis, the differential diagnosis of cholelithiasis of the gallstones are biliary disease, inflamed or perforated duodenal ulcer, hepatitis, appendicitis, renal colic, pneumonia or pleurisy, and pancreatitis. So these are the differential diagnosis of the gallstones. Next is the complication and prevention. So the complications with like in the case of gallbladder are biliary colic, acute and chronic cholecystitis, emphysema, mucosal, and carcinoma. So in the bile duct, what are the complications? That is the obstructive jaundice, pancreatitis, cholangitis. And in the gut, the complication will be gallstone ileus. So these are the complications in the GB, that is the gallbladder, and in the bile duct and the gut. And about the prevention, so there is no sure way to prevent gallstones from forming, but we can advise the patient to take a certain steps to reduce the overall risk. For example, the patient can reduce the risk of cholesterol stones, which are by far the most common type, by reducing cholesterol in the diet. However, this won't prevent the pigment stones, but if you have overweight or having obesity, losing some weight can reduce the risk of cholesterol stones. But losing weight fast can also raise the risk. So if you are expecting a rapid weight loss from a procedure or other treatment, then we have to might we might have to recommend taking gallstone medications for a preventive mode with a preventive motive. So with a sensible diet and very low intake of calories and eating a good source of fiber, so advising them to make little changes in the dietic and lifestyle, so this will help the patients to get a prevention from getting prevention from getting the gallstones condition or cholelithiasis. So this comes to the end of our topic, gallstones or cholelithiasis. Thank you.